in the healthcare IT space. Now, again, going back to original idea, healthcare system is incredibly complex. You have different moving parts and different groups, I would say, focused on various areas. And I would say it's not necessarily all their interests are aligned. How do you deal with that?
Okay, so that's
an advice to entrepreneur. What are you doing?
Okay, so this is one of the first things that I would tell everybody is this is a zero-sum game. There is no new money coming into the system. So the first question I ask, and I used to sit on the investment boards of United and others, is who are you crushing? Who are you taking money from? Right? So if you're building an oncology business, are you taking money from the oncologists? And if you are, explain to me how you're going to do that the patients are actually going to believe you, or that the oncologists are willing to give up their money. Right? So as an example, if you're in the pharmacy benefit business and you're building a oncology business, and this is where you get the subtleties, the interesting thing is that the pharmacy benefit companies walk in the door of every large employer and every health plan and say, if we manage oncology as a pharmacy benefit and not a medical benefit, we can take 20%, there's 20% savings for you. These are because of specialty medicines and the management of specialty meds and drugs. These are big dollars, right? Well, you're taking the money out of the face, which is the oncologist, right? You better figure out a way to do that and do it pleasantly. Otherwise, they're not participating. And so one of the brilliant guys that I worked with, a guy named Norm Payson, who was kind of he was known as the king of capitation. Norm kind of figured it out before anybody did. I'm not sure I love that. But Norm once said, and I'm going to give you some insights, is you don't, pardon my French, screw a face. You go after hospitals and institutions because they're just big, they're amorphous, nobody knows who they are. But you never mess with a doctor because the doctor's face to face with the patient. And that's where the word of mouth comes, right? So that's one piece of the insight. The other piece of the insight is, if I was building a business, one of the major things I'd be doing is I'd be looking at every piece of regulatory reform. I'd be reading the regs. How many of you read the Patient Protection Act? Inside and out? There you go. I read the thing like cover to cover and created 5 businesses. We created a medical home business in 5 minutes, immediately implemented a host of things, and we created $100 million worth of revenue to Medco in less than 6 months. Okay? So you've got to read the regs, because the money is in the regs. It's what's not being said versus what is. I have friends of mine who are traders. That's what they do. Guys on Wall Street read the regs. They see when something's not been ruled on. They have a window of time to trade on it. It's perfectly legal until it's either shut down or never touched. And so you have to follow the velocity of money. You have to follow where the dollar goes and who gets what piece of it. And then there are multiple audiences. And so let's talk about the multiple audiences. How many audiences do you think there are in the healthcare system? In general. We used to frame it at maybe 5 or 6. Okay? I'm not going to include. One is consumers, right? Physicians, or this is another thing that used to tick my butt, calling a physician a provider. I work for a living. I'm a provider to my household. I didn't go to medical school. Don't call me a provider. As a doctor wants to be called an MD. So every time I used to rip the letters apart. I used to go down into the Xerox room and pull the letters when it would say, "Dear provider." It's like, "Dear Dr. So-and-so," much better, thank you very much, right? So you have the physician community, you have the providers, which is the hospital systems, the health plans, the physicians, whatever. You've got the broker community. You've got the employer. You have government, right? And I'm sure I'm missing one. Well, hospitals I'm including a provider. But the interesting dynamic there is none of them have the same agenda. How does a broker get paid? Piece of revenue, commission. Broker would like to sell the highest priced health plan, right? Employer is looking for the cheapest priced health plan. Consumer could give a darn about price, just give me everything I want when I want it. Right? And so one of the things I tell everybody if you're building a business is, all right, you tell me who you're going to displace. Explain to me legally or why that's going to happen. Tell me then who benefits from that. And tell me how you're going to ameliorate the problem that you're going to create among the other audiences who are essentially impacted by this. Rarely will you find that you have all five in sync. But as an example, when Oxford Health Plans was built, it had one focus and one focus only, the consumer. Everything we walked in every day was about the consumer. We just believed that if we kept bringing more and more people to the church, that everybody else would follow. The doctors loved it because we actually set up a system to pay them properly. It wasn't capitation, it was a different model. But the idea was, if you can identify an audience, and from that audience, build the business. These are the insights, and I read some story the other day about one of the venture funds talking about it. People are looking for, what are the insights that you have into the business that makes sense if I'm going to fund you? It's like, who am I going to displace? Where's the money? What legally says I can do that? How am I going to ameliorate the other audiences, and does this make sense? And when you do all that, you've got some businesses that really, really hum.
No, so it's not okay to call doctor provider, but it's okay to call patient consumer.
I think that, I call them consumers in general, but when they are actually seeking medical care, they're a patient.
Right.
But the argument, now you're into the, I used to have arguments with Dr. McGuire, who ran United Healthcare, where they're not patients because they're not our patient. They're a doctor's patient. He says we can't call them members because they didn't voluntarily sign up. I say, screw you, If I talk to them like members as opposed to dear people, people sounds very Soylent Green to me, right? So I would call them members because I wanted to create, I came from a world where I created programs for American Express. So, to me, everybody's a member, and membership has its privileges. And so I was continually trying to create those privileges for the membership, the people who, whether they voluntarily and were paying out of their money, or because I believe everybody's ultimately paying out of their own money, create some reason for them to want to stay.